Hello everyone, welcome to Simsad Aesthetics. I am a professional esthetician and cosmetologist. If you've ever felt confused and frustrated by your contact dermatitis, you're about to get answers. Today, I'm not just talking about a eczema contact dermatitis, but I am going deep on scientific causes, risks, prevention, treatments and more. So subscribe my channel, not to miss latest updates. Section 1. What exactly is contact dermatitis? Breaking down the science. Contact dermatitis is not a single disease but rather a skin reaction resulting from exposure to an external substance. It's an inflammation of the skin characterized by red, itchy, and often painful rashes that develop when the skin comes into contact with a foreign substance. This reaction can be of two types, either allergic, where the immune system is involved, or irritant, which is a direct damage to the skin. The first type, irritant contact dermatitis, is essentially a chemical injury. Imagine a harsh substance like bleach, a strong solvent, or even repeated exposure to water and soap. These are directly toxic to the skin cells. They break down the skin's protective outer layer, damaging the cells themselves. This physical injury acts like an alarm bell. The damaged skin cells, called keratinocytes, release distress signals known as cytokines. These cytokines summon the body's immune cells to the site of the injury, which causes immediate redness, swelling, and pain, the hallmarks of inflammation. It's a direct response to damage. The second type, allergic contact dermatitis, is more like a case of mistaken identity that triggers a specialized immune system response. It begins when a tiny molecule, called a hapten, common examples include nickel or poison ivy oil, slips into the skin. Once inside, it latches onto a larger protein, forming a new compound that the immune system doesn't recognize. Specialized immune sentinels in the skin, called Langerhans cells, grab this unfamiliar compound and travel to the lymph nodes, the training grounds for immune cells. There, they present this compound to naive T cells, effectively teaching them to recognize it as a dangerous threat. This initial sensitization process can take days or weeks and happens without any visible rash. Upon the next exposure, the primed immune system springs into action. Memory T cells rush to the skin and launch a powerful attack against the perceived threat, releasing a flood of inflammatory chemicals like interferon gamma. This triggers intense activation of skin cells and recruits additional immune forces, causing the characteristic blistering, itchy rash. This reaction is not due to direct damage, but rather the body's own defensive overreaction. If I talk about difference, then irritant contact dermatitis ICD is the most common type, accounting for about 80% of cases. It occurs due to interaction with chemical or physical agent. It is a non-immune response, meaning it can happen to anyone if the exposure is strong enough or repeated frequently enough. The severity depends on the potency of the irritant, the duration and frequency of exposure, and the environmental factors like humidity and temperature. However, allergic contact dermatitis, ACD, is a delayed hypersensitivity reaction, involving the immune system. This reaction is specific to individuals who have developed an allergy and is not a universal response to the substance. Section 2. Causes of contact dermatitis. The primary triggers for contact dermatitis are neatly divided into irritants and allergens. The most frequent irritants are substances that physically break down the skin's barrier, including water from frequent wetting and drying, harsh soaps and detergents, disinfectants like bleach, and industrial solvents. On the allergic side, the most common culprits are metals, like nickel in jewelry and belt buckles, fragrances found in a vast array of personal care products. It also includes preservatives like formaldehyde in cosmetics, others are chemicals in rubber and hair dye, and even topical antibiotic ointments. It's also important to be aware of emerging allergens such as the acrylates in gel nail polish, and certain essential oils, which can be potent triggers despite their natural origin. Section 3. Who is at risk? Understanding your vulnerability. While contact dermatitis can affect anyone, your risk isn't random. Your occupation is one of the biggest risk factors. Jobs that involve frequent exposure to chemicals or wet work put you on the front lines. This includes healthcare workers, hairdressers, mechanics, cleaners, construction workers, and florists, all of whom handle irritants and allergens daily. Your hobbies can be just as influential as your job. Activities like gardening, exposure to plants and chemicals, painting, solvents and resins, metalworking, oils and metals, and even knitting, dyes and finishes, can introduce a host of potential triggers. Demographics also play a role. While children can certainly be affected, it is notably more common in adults, largely due to the simple fact of cumulative exposure over a lifetime. Women report a slightly higher incidence, which research suggests may be linked to greater exposure to nickel in jewelry and various allergens in cosmetics. Underlying health is a major component. Individuals with a history of atopic dermatitis, eczema, have a fundamentally compromised skin barrier, making their skin far more vulnerable to irritants. A genetic predisposition, such as a personal or family history of allergies, asthma, or hay fever, also increases the odds of developing the allergic form of the condition. Finally, your environment directly impacts your skin's resilience. Living in a dry, low-humidity climate can chronically weaken the skin's barrier function, making it easier for irritants and allergens to penetrate and cause a reaction. Section 4. Recognizing the symptoms. What does contact dermatitis look and feel like? First of all, let me assure you, don't diagnose and treat it as contact dermatitis by yourself by symptoms. Always consult a professional, authentic esthetician or dermatologist. This is because these same symptoms are of many other skin conditions too, so a professional will handle it accordingly. The symptoms of contact dermatitis are a clear inflammatory response, primarily appearing exactly where the skin made contact. The most common signs include pronounced redness, intense itching, which is often the main complaint, and significant dryness that can lead to cracking and scaling. A burning or stinging sensation is frequent, and the area may become swollen. In acute cases, fluid-filled blisters can form and ooze, while chronic cases lead to thickened, leathery skin. Section 7. The best and latest treatments, from home care to medical interventions. At the first sign of a contact dermatitis rash, itching, redness, or stinging, your immediate goal is to soothe the skin, stop the reaction, and prevent further damage. Follow my research steps in order. Step 1. Immediate self-care and avoidance. Gently but thoroughly wash the affected area with cool or lukewarm water, and a fragrance-free, soap-free cleanser like Vanicream Gentle Cleanser or Cetaphil. This removes any lingering traces of the irritant or allergen. Do not scrub, as this will worsen the irritation. Pat the skin dry with a soft, clean towel, never rub. Step 2. Soothe the inflammation. Apply a cool, damp cloth compress to the area for 15 to 20 minutes. This constricts blood vessels, reducing immediate redness, swelling, and the intense urge to itch. You can repeat this several times a day. For widespread itching, a colloidal oatmeal bath, like Aveeno Soothing Bath Treatment, can provide significant relief. Step 3. Apply a barrier repair moisturizer. Crucial step. While the skin is still slightly damp from the compress or patting dry, immediately apply a thick, fragrance-free emollient or ointment. This locks in moisture and begins repairing the skin's broken barrier. The best products for this are petroleum jelly Vaseline, or a ceramide-rich cream like CeraVe Healing Ointment or Vanicream Moisturizing Cream. Apply a generous layer. This step is non-negotiable for healing. Step 4. Targeted anti-itch treatment. If the itching is persistent and localized, you can apply a thin layer of an over-the-counter hydrocortisone 1% cream, like Cortisone 10, to calm the inflammation. Use this only for a few days. For oozing blisters, calamine lotion can help dry them out and soothe the skin. Step 5. Oral relief. If after above steps, you are not feeling well, then contact a dermatologist or esthetician, as they will prescribe you oral medicines. I am not prescribing you orals, because such medications need prescriptions, and moreover, doctor will suggest you according to your disease condition, which varies. What to avoid? Do not use hot water, as it increases inflammation. Do not scratch, as it further damages the skin and can lead to infection. Avoid using any products with fragrances, alcohols, or acids on the affected area, as they will sting and worsen the condition. Section 6. Prevention is the best medicine. How to protect your skin. This starts with becoming a label detective. Once you know your triggers, you must meticulously read the ingredient lists on all personal care, cleaning, and household products to avoid them. When exposure is unavoidable, use physical barriers. Wear protective gloves, long sleeves, and pants. Be aware that standard rubber gloves can themselves be an allergen, so opt for vinyl or nitrile alternatives instead. Your daily skincare routine is your first line of defense, as I have already cleared previously in this video. Critically, always apply a moisturizer immediately after washing your hands, or showering to seal in hydration and reinforce your skin's barrier. Before using any new cosmetic or skincare product on your face or body, always perform a patch test by applying a small amount to a discrete area, like your inner forearm, and monitoring for a reaction for a few days. For daily, low-level irritant exposure, consider using specialized barrier creams that act as an invisible glove to provide an additional protective layer on the skin. Section 7. Answering your top Google searches on contact dermatitis. Question 1. Is contact dermatitis contagious? Absolutely not. You cannot catch it from or spread it to another person. It is a reaction to an external substance, not an infection. Question 2. How long does it take for a rash to appear? For irritant reactions, it can appear within minutes to hours of exposure. For allergic reactions, due to the delayed immune response, the rash typically appears 24 to 72 hours after exposure. Question 3. When should I see a doctor? Fact: see a doctor, esthetician, or dermatologist if the rash is severe, widespread, or doesn't improve with OTC treatments. Final verdict: living with contact dermatitis requires diligence, but it is absolutely manageable. By understanding your triggers, following a targeted treatment plan, and committing to daily prevention, you can take control of your skin health and significantly reduce flare-ups. Remember, you are not alone in this. Thank you for watching. If this guide was helpful, please like this video and subscribe for more content. Comment for any queries too.